I'm Dr. NIK Haziman. I'm a director of the Medical Malaysia Rugby Union. In rugby, 1 out of 4 players will suffer injuries during season. The common injuries in rugby include muscle injuries, ligament injuries, dislocations, fractures, and last but not least, concussion. Today, I will focus at 3 main regions that usually injures in rugby, which is shoulder, knee, and ankle. The mechanism of the ankle injuries can be due to fall with the ankle position, inversion, or everted this position. So what we worry about what's happened the ligament over the outside area. They have 2 ligament here, and then for the inside we have 4 ligaments that possibly get injured. So we follow the Price principle, which is stand for P for protect, R for rest, I for ice, C for compression, and E for elevation. First principle is a protect. We want to protect the area of the injuries and then prevent further complication of the area of the injuries. So what we'll use actually a splint that will protect the area of the injuries. The second one, R, stand for rest. Mean we rest the players from the field, remove the player out of the field. The third one is ice. We need to put ice, but first of all we need to make sure there is no fractures over the area. What we do actually, we compress over the same area of the injuries. At same time, while we are doing the ice plus compressions, and we elevate the area to reduce the swelling over the specific area. So what we can put actually on the field, okay, we can get our ball. We need to elevate the area just above the gravity. Now we move to the acute knee injuries. How's the player injured? The mechanism of the acute knee injuries, usually they will fall, lost his balance, and then twisted his knee and fall to the ground. And most common injuries occurs due to non-contact injuries. So what are the possibilities of the injuries over the knee? The first one, we need to rule out, is there any fractures over the bone, over the knee area? The second one, it can be due to ligaments injury, which is most commonly is ACL, PCL, MCL, and LCL. The mechanism of the injuries of the shoulder can be, first of all, the players will fall and hit direct to the ground. The second one, it can be tackle from the opponent. How we want to manage the injuries on the field? First of all, because we don't have any equipments, we can use the player's jersey to protect the shoulder area. What we can do actually, we need to put the hand like this, and then we just flip up the jersey so that it will reduce the movement over the shoulder area. So we remove the players out of the field.